I am Femi OK. You're watching the stream. Now, the global pandemic was announced at the end of January, and since then, the stream has done a number of shows, most of them about challenges and missteps. But not today. Today is a celebratory story about the southern state of Kerala in India, and we have to thank for that Nicole Venugopal, who told us in an Instagram live session about the story. Here he is.
So this is one topic. So regarding coronavirus, then again, I would talk about the state of Kerala, which is in India. Now, considering the cases in India, which is going high, Kerala is one state which has actually, considerably brought it down. So it has been a quite opposite of what the national trend is.
So, how is Kerala doing today? Why is it different from the rest of India? I have just the guests to tell you about that. I will say hello to them and they will introduce themselves to you. Madam Minister, welcome to the stream. Tell our international audience who you are.
Okay. Good evening, everybody. I am KK Shailaja, Minister for Health, Family Welfare, and Social Justice and Women and Children in India, Kerala State.
It is very good to have you in this conversation. Uman, welcome to the stream. Tell everybody who you are. Do your own introduction.
Thank you, Femi. Thanks for having me. I'm Uman. I'm a researcher with Delhi's Observer Research Foundation, which is a think tank.
Good to have you. And Dr. Fatahuddin, welcome to the stream. Tell the world who you are.
Good evening, and thank you for inviting me this show. I'm very glad that I could speak something about COVID-19 in Kerala along with my minister. I am Dr. Fatahuddin. I'm currently the professor and head of pulmonary and critical care medicine, and also the COVID-19 nodal officer, who is directly, seeing the patient and treating them in one of the first COVID hospital in Kerala.
Good to have you, everybody. Namaste. All right, so here's the thing. If you are in YouTube right now and you have a question or a comment about the southern state of Kerala, what did they do with their Kerala model, their coronavirus strategy? You can ask our three guests anytime. Jump into the chat. I want to start, though, first with Uman. Uman, Kerala is your home state. What is it that makes it different? Because I think this is the key to how it tackled the coronavirus. Tell us three things that makes it very unusual as a state in India.
Kerala is known for its very high human development indicators. Kerala is a well-known tourism hub, and Kerala's economy depends predominantly on remittances from abroad. These are the key factors I can think of. But when it comes to the COVID pandemic, Kerala is unique. It is because of the high risk factors it started with. It is the most globalized state in India. It has students coming back from China, free flow of people from the Middle East, a high non-communicable disease burden, tourism industry, of course, a very high percentage of the elderly. So millions of people work outside and make regular visits home. So it could have gone easily the Delhi or Mumbai way, but it didn't. So that makes Kerala unique.
Madam Minister, I'm just wondering about the politics in Kerala. How would you describe them?
Yes, everything related to politics, throughout the world, everything related to politics. What's the politics? It is according to the socio-economic status and the way we are dealing with these principles, etc. As Human mentioned, Kerala have a very good social development index here. Over the years, we are working for that, and we achieved something. We have a comparatively equitable society here, which is the after effect of some reforms, especially the land reforms during 1950s, and also a total literacy mission and decentralized planning. And the social reform movements are very rampant here in 1950s, 60s, and 70s. And because of that, Kerala developed more. And in spite of our economic condition, economically we are not a fit state, and our revenue income is not large. And according to, even if the economic status is like that, but our human development indices are very high comparing to
Okay.
other states in India. And we have very good health and education reforms here, very good
Okay.
indices.
All right.
That is the
Madam Minister,
politics here.
you should probably pause there, otherwise everyone's going to want to move to Kerala. I'm going to go to YouTube. I want to put this to you. This is Nilang L. And Nilang is on YouTube watching our conversation right now. Why does central government in India not highlight the story of Kerala? Is it due to political issues of central government as a state government run by a different party, or moving in a different path of handling the pandemic? So why do you think that federal government is not talking more about Kerala? Many Indians are very proud of what you've done.
I don't think so. The central government is speaking about us, our strategy. They are also appreciating us because we started during the corona incident. We started our early preparedness and we prepared proper protocol and standard operating procedures. And Central Health Ministry also came to know about our procedures and they also appreciate us. And also they asked other states to take something from our strategy and protocol. All the states are working hard. They are implementing their own strategies there. But
yes, so you're basically saying the federal government is recognizing you and you are very happy. All right, I want to bring this to you, Doctor. Doctor, welcome into the conversation. Fatima Perez says on YouTube, she doesn't believe the numbers in her own country. I think they are not telling the true numbers just to save face. She said, that is my opinion only. As far as the numbers for Kerala go, are you confident that you are successful as you're telling everybody?
Absolutely. We have nothing to hide. We are transparent in our statistics, especially the number of patients who are tested positive. As you all know, that we don't have any indigenous case. COVID-19 has originated in Wuhan, China, and it has been brought here as a lot of people who are working or students working abroad. So almost 90% of our cases are actually imported cases. Hardly 10% came from contacts, from the primary contact. So otherwise, all the numbers, we got a January 30th, the first case, and I'll tell you till 23/6/20, we actually had 3,451 cases. And out of which, nearly 90% of the cases are imported. And we are testing all these patients, treating them properly and curing them properly, and we have nothing to hide. We have absolute numbers and we are testing people based on the indications, target groups. They are being monitored in the hospital. When they become sick, they are immediately moved to the critical care units. And that is why our mortality rate, our case fatality rate is one of the lowest in the country, and it is roughly 0.6%, 66, as against the national average of 3.5. So we are transparent in our numbers and we have nothing to hide, and these numbers are accurate.
Let me just bring in a report that Al Jazeera did not so long ago. This was when Kerala was doing amazing in terms of the number of cases, who was being hospitalized, etc. And I just want to take a little clip of this so that you can see the testing and how Kerala actually coped with COVID-19 in the very early days. Let's have a look.
Some of India's first confirmed cases of the virus were here in Kerala, as some of the millions who work overseas returned home. At one point, Kerala had the most cases in India. Now that's changed, which the state's leaders put down to intense efforts to break the chain of transmission.
The strategy was test again. And every positive case, trace all the contacts for the last fortnight, test them, quarantine them positive, trace again, till the chain is broken.
Uman, you looked at why Kerala had so much early success, and one of those reasons was the partnership between the local government and the people. How did people react to for instance, a very strict lockdown. Explain what happened there.
I mean, Kerala, as I said, started very early. Kerala announced a lockdown even before the central government or any other Indian state or city announced it. Kerala started with an aggressive testing and tracing strategy, and it quarantined suspect cases. According to many, it overreacted at the beginning, and the results have been great till now. What Kerala has done was to use the trust that the health system has earned from the people over the years, and it has yielded results now.
I want to share this with you, Madam Minister, and it is from Nakul, who we heard from earlier. And Nakul says in a tweet that Kerala did a good job in stopping the Nipah outbreak in 29, which, if not controlled, would have been a disaster. Was that almost a dry run from the plan that you had in place for COVID-19? Let me just tell everybody that Nipah is a viral disease that is transmitted via bats. 40% death rate with it, and if you've ever seen the movie Contagion, that was based on Nipah. Madam Minister, did that help? Did that help?
Yes, okay. Yes, in 2018, there is a Nipah outbreak in Kerala, and it is a newly emerging zoonosis. And we were afraid that time, but we never get back, and we started contact tracing and isolation and treating them properly that affected people. And that Nipah incident gives us some enthusiasm, and it is a test dose to our health system resilience. And at that time, we prepared ourselves to tackle that problem, and we contained that virus within a short span of time, and within a short space. We contained that virus within 14 days. And only 18 people got infected, and out of that, 16 succumbed to death because, as you know, the mortality rate of Nipah virus is too high, and two saved after we can save the 2 lives out of Nipah virus. At that time, we took the one world, one health approach, and we converged all the line departments together. And together we fought hard against the Nipah virus. At that time, that preparedness and practices give us some experience, and that helped very much in this corona scenario also. And now our objective was straight and clear from the beginning itself. That is to minimize the spread of the virus and also to reduce the mortality rate, to flatten the curve and to reduce the mortality rate. And we implemented three strategies for that. That is also we took from Nipah experience. And the first strategy is against the potential virus, how to find out the virus as early as possible, how to trace it. Our strategy is to trace, quarantine, test, isolate, and treat. That was not test, nothing else.
Madam Minister, may I just give a couple of visual examples? Madam Minister, if I may I give a couple of visual examples, because often it's easier to see what you did if you can see pictures of it. So I want to show you a few pictures. Come here to my laptop. Madam Minister, you know this already, so I'm going to release you from having to see this. But this is Dilip V. Kumar. And here, this is an incredible story here, because we have the COVID care workers, and they work for 10 days and they have 10 days off, which is in contrast to many European countries who were really strained in terms of what were their health workers able to do when they're treating COVID-19 patients. Another story here, very simple one, of exams. Thomas Isaac says here, 14 days ago, school students completed their school final exams in Kerala. Not a single student affected by COVID. It was meticulously planned. Schools were sanitized, masks distributed to all, and then flying. What does it look like? What do your flight attendants look like? Let me just move up here, and they look like you're actually basically in a ward. These are your flight attendants. This is a flight not fully full. Uman, when you're looking at this as somebody who knows about public health, what are these pictures telling you? Are you seeing these pictures elsewhere in the world? Because, of course, we're in a global pandemic.
Yeah, I would say Kerala has learned its lessons from the Nipah outbreak, and also, I mean, partly from the two major floods, where the government successfully prevented spread of any possible epidemic. And this has contributed to the state machinery learning lessons, putting in protocols which help contain the virus at the beginning, so that the problem is not large now to handle. So even when Kerala has to bring back a lot of potentially infected high risk population from the Gulf or other countries, they have very strictly followed protocols in place, which is helping the government in a way to pace the spread of the virus. So, but only the first phase is now over, and the state managed to keep mortalities low and the spread limited. But the coming challenges, as I speak, are going to be harder.
I'm really glad you brought up those coming challenges. Have a look here at my laptop. The highest single day spike of 138 COVID-19 cases in Kerala. That headline is from this week. And I also want you to have a listen to Joseph, who is a journalist, who is concerned that the early successes that Kerala have are maybe beginning to be eroded. Let's have a listen to Joseph.
The situation in Kerala is a rather challenging one right now, I feel, because ever since the lockdown was lifted and air travel was allowed back again, there has been a massive inflow of people from across the world as well as from neighboring Indian states, and that has seen a massive rise in the number of COVID cases. The state will have to be on high alert in the next few weeks because lakhs of people are expected to return home from various parts of the world. So it will take time for things to get under control, and Kerala will have to be on their guard.
So, Doctor, we've heard about the strategy that you had as a state in the early days, and now there's a spike in cases. Why, and what are you going to do?
We have the full capacity, and we actually had plan A, B, and C. In the initial stages, when we started getting small cases trickling in, we had a lot of beds vacant. But then during the lockdown period also, we didn't have much cases, so we could make up our infrastructure. Now, we were expecting, this is not new, we were expecting this large number of inflow, so much so that we have actually expanded our healthcare system. As you know, in Kerala, we have a highly reinforced decentralized peripheral health institutions connected to the mid-level general hospitals up to the teaching care hospitals. So what we did was that we actually made enough beds in the peripheral health institutions for peripheral health care. Those patients who are having mild symptoms, those patients who have got moderate symptoms, we have arranged beds in the mid-level hospitals, and those patients who are having the advanced severe disease in the medical college hospitals. So we are absolutely prepared. But just like any other government, when the number of cases becomes so much, it is but natural that the health system could overwhelm. But as of now, we are more confident that we will, at most of the time, at this point of time, as I speak to you, the large number of cases reported being today, all are imported cases. Many of them are just positive cases only. Luckily, they probably don't have much symptoms. They are asymptomatic. Those patients are also initially
But Doctor, there's no way that you can know if they're asymptomatic until you test them. Let me just ask you this very briefly, because we're almost at the end of the show. Jaron George, Dr. Fatahuddin, is on YouTube. Jaron says, what are the total number of COVID-19 tests done in Kerala? Do you keep track? Have you kept track?
It's to me.
No. See, basically all these cases, when they know we are actually putting straight into quarantine, and all our cases are tracked at the peripheral level by the all the health inspectors. They will actually trace them. The district administration know them. The local panchayat members know them. So they have been traced to the core, and we will not miss or slip of any cases.
All right. Thank you, Dr. Fatahuddin. Uman, what did you want to add? Go ahead.
Yeah, Kerala has till now tested around 200,000 samples. It has found 3,600 or so cases. So the test positivity rate is low. It is still low today. Today, around 14,000 people are coming back in 70 flights as we speak today. Kerala has found 150 new cases. Positivity rate is still kept at 3 for today's tests. So the testing is still adequate. Any worry on that front is not based on facts.
I'm going to bring in Rishav Parasa. It sounds like a criticism, but it is a compliment, Madam Minister. The government in Kerala is not prioritising the economy. Rather, they're giving priority to the health of people residing in their state. Hence, Kerala has been successful fighting the dreadful virus. But at some point, Madam Minister, you do have to think about the economy. What are you going to do?
Yes, our country is following a mixed economy system. But in Kerala, we are trying to have equal distribution of the money and power. And because of the decentralized planning, we are able to equalize these things, or considering the poorest of the poor, and we are helping them. During this coronavirus epidemic, our Chief Minister declared a package of 20,000 crores worth. It is for helping the poor people, and we are protecting them. We have addressed all the needs of the poor people, and we are providing them food and everything, medicine, everything they wanted. And we opened 1,325 community kitchen, and we feed 86 lakhs of people. They are provided by cooked meal, and we provided them also
Madam
rice
Minister,
and other things.
Madam Minister, that is what you did. I was just wondering what you were going to do in the future. We will just keep watching to keep track of that. Uman, I'm thinking about monsoon season coming, and then on top of coping with a COVID-19 spike, how do you think your home state will manage?
Yes. Monsoon season is coming, and there are many Malayalis, that is Keralites, who are waiting to come to Kerala back from their countries where they have lost their jobs, they feel insecure. So these are hundreds of thousands of people. So in addition, that is going to put some pressure on the health system. In addition, there will be the monsoon risks of dengue, chikungunya, leptospirosis, and the already stressed healthcare delivery system will have to find resources to treat these new patients without them contracting COVID. But Kerala's experience in limiting infectious diseases during the two big floods over the last few years will come in handy. That's what I think.
Oh, and there's one map I want to show you, one graph. It's really important. It's the India coronavirus map and case count. We're right at the very end of the show, but we can see here in February, 0 cases, and then going up to new cases, climbing higher. If the rest of India follow the Kerala model, do you think India will be flattening curve right now?
Yeah. India's cases and deaths are driven by 2 or 3 cities. If they had intervened early on, like Kerala did, with aggressive testing at the beginning, we could have certainly controlled the silent spread which resulted in the current large base we see in these regions, which is driving deaths and infection.
Uman, thank you so much for telling us about the state of Kerala and its approach to COVID-19. Madam Minister, we appreciate your time. I know you're very busy. And Dr. Fatahuddin, thank you for your insight. And YouTube, thanks for all of your questions. Really appreciate them. And that wraps up the stream for today. Take care, everybody. See you next time.